Right now, over 500 million people on this planet are living with diabetes, and more than 90% of them have type 2. There's a good chance you know someone with it. A parent, a grandparent, a friend, maybe even you. But here's the problem. Type 2 diabetes is one of the most misunderstood conditions out there. People think it's just about sugar. They think it only happens to older people. They think it's always your fault. None of that is fully true. In the next minutes, I'm going to walk you through everything. What type 2 diabetes actually is, why it happens, the early warning signs almost everyone misses, how it's diagnosed, every treatment option on the table, the complications you need to watch for, and, most importantly, how it can be prevented or even put into remission. Stick around till the end, because I'm covering the myths that are quietly making people sicker. Let's get into it. What is type 2 diabetes? Really? Now let's start with the basics. Every time you eat, your body breaks food down into glucose, a type of sugar that flows into your bloodstream. That glucose is your fuel. But glucose can't just float around in your blood forever. It needs to get into your cells to be used as energy. That's where insulin comes in. Insulin is a hormone made by your pancreas, and think of it as a key that unlocks your cells so glucose can get inside. In type 2 diabetes, two things typically go wrong. 1. Insulin resistance. Your cells stop responding properly to insulin's key. The lock gets rusty, so glucose builds up in the blood instead of entering the cells. 2. Insulin insufficiency. Over time, your pancreas struggles to keep up with the extra demand, and it produces less insulin than your body needs. The result? Chronically high blood sugar, what doctors call hyperglycemia. This is different from type 1 diabetes, which is an autoimmune condition where the body attacks the insulin-producing cells directly, usually starting in childhood. Type 2 develops gradually, often over years, and it's driven by a mix of genetics, lifestyle, and metabolic factors. Who gets type 2 diabetes? And why? Let's talk risk factors, because this is where a lot of the myths live. Genetics matter a lot. If a parent or sibling has type 2 diabetes, your risk goes up significantly. This isn't just bad habits passed down. There are real genetic and epigenetic factors at play. Weight and body fat distribution. Excess fat, especially visceral fat around the abdomen, is strongly linked to insulin resistance. But here's the nuance. Not everyone with type 2 diabetes is overweight, and not everyone who's overweight develops diabetes. Body composition, ethnicity, and genetics all interact here. Ethnicity. People of South Asian, African, Hispanic, and indigenous descent have a statistically higher risk, even at lower body weights. This is a well-documented pattern in medical research. Age. Risk rises after 45, though we're seeing more and more diagnoses in younger adults and even teenagers, largely tied to rising obesity rates and sedentary lifestyles. Physical inactivity and diet. Long periods of sitting, diets high in refined carbohydrates and ultra-processed food, and poor sleep all increase insulin resistance over time. Other conditions. PCOS, high blood pressure, and a history of gestational diabetes during pregnancy all raise your risk. The key takeaway? Type 2 diabetes is multi-causal. It's not simply eating too much sugar. It's genetics loading the gun and lifestyle sometimes pulling the trigger. Early symptoms. What people miss. This is the part that saves lives, so pay attention. Type 2. Diabetes develops slowly, and symptoms can be so mild in the early stages that people live with undiagnosed diabetes for years. In fact, it's estimated that a large share of people with type 2 diabetes don't even know they have it. Here are the signs to watch for: excessive thirst and frequent urination. As blood sugar rises, your kidneys work overtime trying to flush out the excess glucose, pulling water from your tissues. Constant fatigue. Your cells aren't getting the glucose they need for energy, even though there's plenty in your blood. Blurred vision. High blood sugar can cause the lens of the eye to swell. Slow-healing cuts or wounds, high glucose impairs circulation and immune function. Numbness or tingling in hands and feet, an early sign of nerve damage called neuropathy. Unexplained weight loss, even while eating normally in some cases. Darkened patches of skin, especially around the neck or armpits, a condition called Acanthosis Nigricans, which is a visible marker of insulin resistance. Frequent infections, especially yeast infections, since glucose feeds fungal and bacterial growth. If several of these sound familiar, it doesn't mean you have diabetes, but it does mean it's worth getting checked. How doctors diagnose it. Diagnosis is done through blood tests, and there are three main ones. 1.A1C test measures your average blood sugar over the past 2 to 3 months. An A1C of 6.5% or higher on 2 separate tests indicates diabetes. 5.7 to 6.4% is considered prediabetes. 2. Fasting plasma glucose test measures blood sugar after at least 8 hours without eating. 126 mg/dL or higher indicates diabetes. 3. Oral glucose tolerance test measures blood sugar before and 2 hours after drinking a sugary solution. Prediabetes is a critical checkpoint. It means your blood sugar is higher than normal but not yet in the diabetic range, and it's often reversible with lifestyle changes. This is genuinely one of the most important windows for prevention. Complications. Why management matters. Here's the part that makes type 2 diabetes serious. It's not really about the sugar itself. It's about what chronically high blood sugar does to your blood vessels and nerves over time. Cardiovascular disease. Diabetes significantly raises the risk of heart attack and stroke. It's one of the leading causes of death in people with diabetes. Kidney disease, nephropathy. High blood sugar damages the tiny filtering units in your kidneys, and diabetes is a leading cause of kidney failure worldwide. Nerve damage, neuropathy, often starts in the feet and hands, causing numbness, tingling, or pain, and can eventually affect digestion and other organ systems. Eye damage, retinopathy. Diabetes is a leading cause of blindness in working-age adults. Poor wound healing and risk of amputation, reduced circulation, and nerve damage in the feet can turn small injuries into serious infections. Mental health. People with diabetes have notably higher rates of depression and anxiety, often tied to the daily burden of management. This deserves far more attention than it gets. The encouraging news: nearly all of these complications can be significantly delayed or prevented with good blood sugar control, regular screening, and early intervention. Treatment. What actually works? This is the section everyone's waiting for. Treatment for type 2 diabetes usually involves a combination of approaches. 1. Nutrition. There's no single diabetic diet, but patterns that consistently help include prioritizing fiber-rich vegetables, legumes, and whole grains over refined carbs, pairing carbohydrates with protein and fat to slow glucose spikes, reducing sugary drinks, which are strongly linked to insulin resistance, portion awareness rather than extreme restriction. 2. Physical activity. Exercise makes your muscles more sensitive to insulin, sometimes within a single session. Both aerobic exercise, walking, cycling, and resistance training, weights, are effective, and combining both tends to work best. 3. Weight management. For people carrying excess weight, even a 5–10% reduction in body weight can meaningfully improve insulin sensitivity and blood sugar control. 4. Medications. Metformin is typically the first-line medication. It reduces glucose production in the liver and improves insulin sensitivity. GLP-1 receptor agonists, like semaglutide and SGLT2 inhibitors, are increasingly used. They help lower blood sugar and have shown cardiovascular and kidney benefits. Sulfonylureas and other agents stimulate the pancreas to release more insulin. Insulin therapy may eventually be needed if the pancreas can't produce enough on its own. This isn't a failure, it's simply how the disease can progress for some people. 5. Monitoring regular blood sugar checks, A1C testing every 3 to 6 months, and annual screenings for eyes, kidneys, and feet are essential parts of long-term management. A note on remission emerging research shows that some people, particularly those who make substantial changes early after diagnosis, can achieve remission, meaning blood sugar returns to normal ranges without medication. It's not guaranteed for everyone, and it requires medical supervision, but it's a genuinely exciting area of diabetes research. Myths debunked. Let's clear up a few things fast. Diabetes is caused by eating too much sugar. Not directly true. It's about long-term insulin resistance from multiple factors, not a single food. Only overweight people get type 2 diabetes. False. Genetics and ethnicity play a major role, and normal weight individuals absolutely develop it. You can't eat carbs at all. False. It's about type, quantity, and pairing, not total elimination. It's not that serious. Also false. Untreated, it's a leading cause of heart disease, kidney failure, and blindness. Insulin means you failed. Absolutely false. Insulin is simply a tool, and needing it reflects disease progression, not personal failure. Type 2 diabetes is common, it's serious, but it's also one of the most manageable, and in some cases, preventable, chronic conditions out there. The earlier you catch it, the more power you have over it. If this video helped you understand diabetes a little better, hit subscribe, drop a comment with any questions you want answered in a follow-up video, and share this with someone who needs to hear it. This video is for educational purposes only and isn't a substitute for medical advice. Always talk to your doctor about your personal risk and treatment options. Thanks for watching, and I'll see you in the next one.